Serious. Okay.
Good morning. Good morning, everyone who's already joined us on the call. I'm so excited to see so many moms here. And I'm also excited. I know a lot of you will be watching this at a later stage. And we welcome Valérie Druon today, who is a family physician, and she will do a big introduction of herself as well. She works at Osler Health. And we're super excited and thankful that you could take an hour out of your very busy morning to speak to our mummies about perimenopause. So I'll hand over to you, Valérie. It would be so nice if you could give us a little introduction of who
Well,
you are and why you're so passionate about this topic.
thank you. Thank you, Joanna. And thank you, everyone, for having me on the opportunity to present this topic. I'm Dr. Valérie Druon. I was born in France. My parents are Vietnamese. I lived for 16 years in France and spent 20 years afterwards in Australia. So I had more. I had my medical degree and my medical teaching as a GP in Australia. I've been a doctor for 24 years, 12 years of which in Singapore, mainly for the expat communities.
Wow.
I'm married. I have two teenagers, and I'm going to switch to my slide, and let me figure out how to do this.
Perfect. Amazing. And so, Valerie, we were just saying,
Yes.
you were just sharing earlier that in medical school, you don't actually learn much about perimenopause at all. So I love that you're taking this interest now and learning more. And we keep learning, don't we?
We
Everyone.
do. We do keep learning. So yes, it's true. We don't learn much in medical school, even in my GP training. We don't really. It's a brush up. It's a 1 hour topic. Okay, at the end, around 50 women will have a drop of progesterone, estrogen, and that's the menopause, and they get their hot flush, and there's not much spoken about it. There's a bit about HRT, but they all said, HRT is not good to prescribe that kind of thing.
Wow.
So a bit about myself on this first slide. So the reason why I put that lotus flower that you see there is because this year I went to Hanoi to connect with my French Vietnamese heritage, and I celebrated my 50th.
Wow.
So the lotus flower is the national symbolic flower of Vietnam. And just for interest and all that, because you would love to visit Vietnam one day, I'm sure you have already. The lotus is a symbol of resilience. It's grown in muddy water, and it would thrive under harsh conditions to blossom and flourish. So it's a sign of spiritual enlightenment, if you like. So that's why I put this flower there. Yes. Most of my information, I've been a GP for 24 years, and I must say that my ikigai is medicine. I'm passionate about medicine. The human being, how it's connected, the mind is connected to the body. And that's what, when we talk about being a GP, looking at the patient in a holistic approach, this is what we mean. We don't just look at the symptoms and treat just the symptom. We look at the cause. All the many causes. So a lot of my slides will be quite in depth, and I apologize for it. I will do my best to make it relevant to you. I also would like to endorse that I'm a member of a few societies: the Australian Menopause Society, the International Menopause Society, the two Lifestyle Medicine Society, American and Australasian. And that would reflect on what I will be discussing about how to flourish through the menopause, the perimenopause, in the most satisfying way with the best support, increasing that self-awareness, and how to be proactive and seek help about it.
Amazing. Thank you.
You're welcome. Okay, so next slide. Okay, a little bit of history, and please take the time to look at the history of menopause. It's so fascinating to see how the human mind and how we behave towards each other has evolved exponentially over time in a positive way. So in the ancient Greek time, the ancient Greek time, as you will realize that women would not live until the menopause. They would not live until around 50, 51, because of many factors, you know, infection, trauma, childbirth issues, and things like that. So in the Greek time, the word, they came up with the word hystera, which actually means womb. And there's an association between, you see that linguistic association in the word hysterectomy, which is removal of the womb. And then in the old time, that the hysterectomy, removal of the womb, that was a way to treat menopause. Okay? So looking over time in the Middle Age, medicine was not very evolved. There was a lot of superstition, a lot of religious belief. So when women reach the perimenopause, the menopause, obviously because of the mood swings, the hot flushes, the insomnia, and the skin being all wrinkled, the hair being all dry and all that, the women were actually called witches, yes, and they were treated as witch. So they also called demonic because they were having hot flushes and they were all working out at night and doing things. So they were not. So this is where the stigma comes from. Okay. So in May, and then around the 19th century, there's a French physician called Charles-Pierre Louis de Garden, it's the middle part, have acknowledged that women in the 50s are going through something called menopause, and that hysteria itself is a nervous affection of the uterus, a typical symptom of the menopause. And again, not much could be done in terms of helping them, but they were using a lot of tragic way to treat them, like creating some asylum and locking them away against the will, causing removing the uterus, removing the ovaries, giving them some harsh treatments.
Wow, I'm quite lucky to live in our times.
It's really, really fascinating. So women were, and this is where the stigma comes from. In the 1959, three American physicians described the menopause as a rather unpleasant and possibly dangerous period of life. Okay, so you can see from the history that menopause has been considered as a pathological transition.
Mm-hmm.
Now, fast forward to today. Hallelujah. I'm so glad to see that the Lancet is the world's most renowned, prestigious medical journal, and has launched the 2024 series on menopause. They have recognized that menopause is a natural life transition in women, and that it affects half of the world population. We are going to live longer. The average longevity is in the 80s, right? We live until 80s at the moment, and maybe longer. And the experience can vary in a very vast way. So they have launched this series on menopause to help health professionals about ways to approach and support and empower women to go through this transition stage of their life. So the menopause transition, I'll have broken it into very simple ways. There's a premenopause phase, which is that normal cycles, no issues around the menstrual cycle, and then you have the perimenopause phase and the postmenopause phase. Okay, so by definition, menopause is 12 months after your last period. This is very important. And this is, in many guidelines, are saying from the age of 50. So, for example, your last period was at the age of 50. 12 months later, at 51, you have not had a period. That is menopause. Okay. Postmenopause is anything afterwards. Perimenopause is the time when your cycle has started to become irregular. So, by definition, is 7 days. So, for example, you're menstruating every 28 days, and suddenly it's 21 days, and then it's 35 days. It could also be in the very early stage of perimenopause. So the perimenopause normally starts around 45. So sometime around 45, maybe 40, and all that, you still have regular period, but like in terms of timing, 28 days, 28 days, but your period itself are different in the sense that it's lighter or it's heavier, or you're having more PMS symptoms. So that could be a sign or symptoms of perimenopause. And I will talk about the symptoms a bit later. Now, at the bottom of the slide, 2 to 4% of women experience what we call premature ovarian insufficiency. The old term was called premature menopause before the age of 40. Okay, 2 to 4%. That is a big number. And I'm so glad that I'm able to help you about this, because I will talk to you about the symptoms, how to recognize it, what are all the factors in relation to it, and how you can help yourself, not necessarily with medication, with lifestyle. Remember, I'm a big advocate of lifestyle medicine. Now, 8 to 10% experience menopause early. So we classify them as early menopause at the age of 40 to 44. Earlier, I said that menopause, the real menopause is 12 months after, of no period after your last period, from the age of 50. Now, many guidelines are saying before 40, let's be careful about labeling this. Let's say that it is more 24 months, 2 years of no period consecutively from the last period before we can sort of officially diagnose a woman of menopause. Mm-hmm. Now, yes, at the moment, 1 billion of women in the world are postmenopause. That is a very big number. And there's a whole health complication related to being postmenopausal. Okay, very, very important slide in a nutshell. I'm sorry about the scribble here. I don't know what happened.
Very much.
Okay. The blue scribble. Ignore the blue scribble. Yes, I see. Okay. So, what do you need to see? At the bottom axis, you see the age, 25, 35, 50, 60, and all that. Look at 35. This is where your estrogen in red, your progesterone, your testosterone in green, and your melatonin all start to decline. Mm-hmm. Okay? And at 50, it starts to be low in number. Yeah, and continue. Okay, this is important because this is how we can explain the symptoms. So estrogen is for your period, your youth, your collagen, your skin elasticity and everything. Progesterone is for mood regulation, how heavy your periods are, whether you're going to sleep well or not. Your testosterone, we do have a little bit of testosterone, is for our motivation, our drive, our muscular health, our bone health as well. Our libido, mainly libido. Melatonin is a sleep hormone, so all that starts to decline. So you can see where from the age of 55, symptoms of perimenopause start to come in. Next slide. Okay. Yes, there's this book written by Perimenopause Laws Reframing the End of Menstruation. And this slide is fantastic. It's very nicely illustrated. I agree. It is the perimenopause is the second puberty. I have 2 teenagers myself, 14 and 16, and I can tell you, wow. While I'm losing sleep, they are losing sleep as well. So it is quite important to understand what women around the perimenopause are going through and the support that they have to give as a mother of teenagers, as a career woman, maybe as a supportive wife, as caring for our parents as well. Okay, so the red line is the estradiol, which is the natural estrogen hormone in that women produce. Okay, so as you can see in the puberty stage, the teenagers are producing estradiol, which is made from the ovaries, in erratic amount, as you can see, but it's more in the improvement. So until, and that's why the hair are much thicker, the skin is more elastic, they can eat better, they can eat as much as they want, and they look so slim and beautiful and everything. Then during the reproductive years, everything is going well. There's a good balance of progesterone, estrogen, as you can see, the up and down. So you are menstruating, ovulating every month and all that. So all that is fertility. Then towards the perimenopause phase, could be like usually 45, but could be 40, could be 35. You can to see perimenopause. So as you can see, the red line, the estradiol going erratically up and down, up and down, up and down, up and down. And then it doesn't match the high and the low of the progesterone. So when women comes and say, I think there's something wrong with my hormones, can you do a blood test? Can you check my hormones? Well, I would say, no, I cannot do a blood test because it would not tell me what's going on. So your hormone, estrogen, progesterone, can fluctuate hourly, if you like. So morning, it will be very nice. Evening, it will be catastrophic low. So depending on the timing of the day, your estrogen, progesterone level on the blood test will reflect that time of your period. So it would not give me any information. So many women have come to us and said, well, I don't know what's going on. I have this joint pain, I have this irregular hot flushes, and yet someone has done a blood test and my hormones are okay, they're normal. Or the other way around. I've done my hormone, I'm still having periods, what's going on? But my hormone says that it's terrible, it's terrible. So I've been told that I'm menopausal and I don't know how to cope with this. So this is very dangerous. So it is important to be aware of this, and please do not ask your doctor to do your hormones. There are other ways to figure it out.
Dr. Valerie, can I ask you at this stage, do you do in clinic the Dutch testing? Because that's a relatively new test that is based on saliva and so on. Is that something that Osler offers? On a hormone profile and
we do a lot of longevity testing. Yes, epigenetic, more blood tests related at the moment. Yes.
Okay.
But there are other ways, and like the anti-Mullerian hormone, doing an ultrasound, looking about how many eggs you have left, that kind of thing. And it's a bit more to diagnose someone of perimenopause, which I come into it. Is a little bit more, we need to look, and again, being a holistic doctor, we need to look, I like the zoom in, zoom out. So zoom in is looking at the symptoms, zoom out is looking at the person in a wider context. So we tend to look in the wider context and join the dots together. It's a bit of a Sherlock Holmes thing, yes.
We have a question. Would you mind me asking you?
Okay, go ahead.
On blood tests, it makes sense not to take blood tests to understand what is going on, given the fluctuations. But does it make sense to do it to get a baseline, to measure over a longer period of time, 6 months, 1 year, and so on, to see how it's developing?
If you're talking about progesterone, estrogen, FSH, LH, no, I don't think it would help.
Not much point.
Yeah.
Okay.
I must say there are special group. So if, for example, I don't know, I just put your number, 45, and you have not had your period for a year, for 2 years, that would make sense. And to diagnose the menopause, we need two blood tests, progesterone, estrogen, FSH, at least 6 weeks apart, not being on the pill, to be in the menopause range.
Yeah, okay.
So we have to be extremely careful about that. And we need to look at other factors. Like, remember during COVID time, when you have COVID, it's highly stressful. When you get the COVID injection, vaccine is very stressful for the body. And a lot of women did not have the period for 3 months and all that. We cannot say, you're in a menopause because your level are low. We have to be extremely careful. And we have patients who have been told that they've been menopause and they came back pregnant. So this is a very big deal.
Okay.
Yeah.
And I think it's also a little bit influenced by lots of us have taken hormonal contraceptive pill, for example, or
Yeah, exactly.
and again that kind of masks the situation as well, I think.
Exactly. So those blood tests need to be done without the contraceptive pill. Very true, very true. And you need to look at all the conditions. Hypothyroidism can cause that, low thyroid, iron deficiency, sorry to say, eating disorders, anorexia nervosa, extreme stress, physical stress, and mental stress, emotional stress. All that can affect, actually, stress is the new pandemic. Chronic stress, cortisol level through the roof, for example, which I don't really measure. Just taking the history tells me that that person has cortisol level through the roof. That can suppress ovulation. Because what will the body do? I need to conserve the energy for this person to survive. So I'm not going to let her ovulate. I'm not going to let her lose, menstruate, lose more iron. She needs to survive.
Yeah, amazing.
Yeah. So this is very important.
We are such complex creatures, and I love that you have this interest in lifestyle medicine because it's more than about doing blood tests. It's looking at it holistically, and I think a lot of us find it quite difficult to get to the bottom of it and the root. So it's good to have a partner like you on board who can help us with that and help us figure out what's going on.
And more than happy to help. So and we love to take our time for that. So yeah, we encourage women to talk about it openly, and usually they would come with their children, and by the way, this and that, and or they have a call, or by the way, what do you think? Can you do a blood test to test my libido, something like that? I tend to encourage, please take your time for your health.
Yeah.
Yes. So let's sit down together, and most of our consultation is at least 1 hour, 45 minutes, 1 hour. Yes. Okay, so how does menopause affect your body? Very important to see. Well, do you know that we have estrogen, progesterone, testosterone receptors everywhere in our brain, in our bone, in our muscle, in our digestive system, skin, heart, blood vessel, our endocrine system. So it affects everywhere. So a drop in estrogen, testosterone level affects we are all aware of osteoporosis, the loss of bone density after the menopause. Okay, our muscle strength decline. Okay, sarcopenia is the term. So meaning that you're losing your muscle bulk and your muscle mass and your muscle strength. Digestive system. So and then there will be other sides where suddenly women. For example, if you suffer from IBS, irritable bowel syndrome, it can be more pronounced in the perimenopause time.
Okay.
Urogenital system. Suddenly, obviously, with after childbirth, please go and see the pelvic floor physiotherapist, because that is very important. Your pelvic floor, because the dryness, you're getting a lot of urinary tract infection, getting a bit of yeast infection, getting a bit of constipation, things like that. Brain. Okay, so how does that affect? And I will spend quite a bit of time on that one later on. It does affect. We all hear about the term brain fog. Okay, losing concentration. I don't remember, that kind of thing. And by the way, remember my slide about the teenagers and the perimenopause women. The teenagers do have the brain fog too, and there's an explanation for it. Okay, yes, because of the hormone imbalance. So don't be too hard on them. Skin, you're losing your elasticity, your hair, hard blood vessel. Talking about skin, easier to talk about skin because you can see from your skin that your skin is drier, is more wrinkly, is less elastic. Well, think about it on the internal level. Your blood vessel could be like that too. Your digestive system, all the cells in your intestine, your lung, your brain cell, your bone, your muscle, they're starting to lose their elasticity. They're starting to lose the elasticity, the thickness, and the resilience. So around the perimenopause and after the menopause, the number one mortality rate, I must say, in women is heart disease because our arteries hardened. The surface is a little bit more rough. Cholesterol, sugar, blood pressure, all that start to block our arteries. And suddenly, that cholesterol that was a little bit high and you got away during your reproductive life, it matters a lot. Yes, the fact that you smoke matters a lot. Your blood pressure that has been a little bit high here and there, all that matters for your heart health. Endocrine system, yes, it's true. Insulin resistance, putting on weight, our metabolic rate will decrease. I'm so sorry. It's not always so gloomy, but the majority of the time it does decrease a little bit. So we eat a little bit to maintain we're decreasing our calories to maintain the same weight, or we are increasing our exercise to maintain the same weight. It is true. And if we put on weight, it is in the tummy.
Yes.
So that visceral fat. Very important that visceral fat is not good. And at Osler, lifestyle medicine, we don't talk about BMI, we talk about body composition.
Nice.
People are think, oh, I put on 2 kilos. Well, I say, well, I try to lie them up. Well, I'm sure it's muscle mass, I'm sure it's bone mass, and I'm sure it's all brain mass. And we have a good laugh about it. Yes, yes.
Yeah.
So visceral fat, yes, cause insulin resistance, which cause diabetes, cause fatty liver, can cause the metabolic syndrome, meaning that increasing your cholesterol, your glyceride, your blood pressure, and so on, for your heart health and everything like that. Yeah. What are the symptoms? Okay, so you know all about the vasomotor symptoms, which are hot flushes, night sweat, change in menstrual period, the dryness, the vaginal dryness, the urinary symptoms. So I have to go to the toilet all the time. We call it urge or stress incontinence. So, for example, many mothers can't go on the trampoline anymore. But if you see a physio for pelvic floor, you'll be amazed. I've seen mothers giving birth to 2 or 3 children, and yes, they can go on the trampoline. It's amazing. Sleep disturbance, a big issue here. So the night sweat that comes in the middle of the night that wakes you up all the time. It's too hot, it's too cold. I'm thinking of the blanket. I wake up for about little thing, noise factors and everything. I can't get back to sleep. Affects your performance as well at work. Mm-hmm. I need to get up at 6 a.m. I need to get my kids ready for school. I need to go to work. I need to deliver this meeting. I'm sitting in a meeting. I'm having hot flushes. I cannot think clearly. The mood changes. Yeah. So I can't think clearly. It affects my memory, my concentration. I am tired. I'm not performing well. And the libido. So this is a slide on libido. Again, I'm reading on the right-hand side, I'm repeating the symptoms, all due to estrogen, testosterone declining. I must say estrogen it is considered as a longevity hormone, if you like, a youth hormone, as an anti-aging hormone, because it helps to improve or build the collagen system of the elasticity and everything, not only of your skin, but all of your structure inside. So not very nice symptoms. Okay, mm-hmm. As you can see, abdomen losing muscle, breast dropping and flatten. I'm so sorry. Nipple become small and flatten. The anti-sexy symptoms are all listed here. Okay. Headaches, hot flushes, gum receding, hair become thinner, skin become rougher, dryness and shrinking of the skin of the vagina, losing bone mass and muscle mass. Very big deal for the postmenopausal time, osteoporosis and frailty, fall prevention and all that. All that is a big deal. So it is important to know now, and I tell my children, I tell parents of newborn babies, please, lifestyle medicine, everything is like, if you're into finance, It's like compound interest, right? You put a little bit in your bank account every day. You invest into your health every day, and it will pay off.
This is
well or unwell. Yes, depending on your investing. Yes.
So that's why we're doing the talk now, because I see a lot of our mummies, we don't realize what's happening until it's never too late, of course. But we can do so much to build a strong foundation.
Yes, very true. Yes.
To have less of these symptoms, to live an enjoyable life, even in our post-menopause.
That's very true. And we are very driven towards health span, longevity, living well, basically, meaning that spending the last 10 years of your life looking and feeling as much as you can, like today. This is the goal of medicine.
Yeah.
Lifestyle medicine. Okay. Busy slide. Another important slide. So only 20% of women will go through the perimenopause without symptoms. So it does affect all of us, the half of the world population. Okay. So the first circle is perimenopause. And like I said, it could be start at 25, can start at 45. The symptoms are very subtle. You don't realize that you're going through it until years and years later. So it's good to see, okay, I'm getting a little bit too many mood swings, and I'm getting a bit more pronounced PMS symptoms. We know that emotional, without understanding, little stress will cause me to react in a deeper way. Yes. The sore breath, the anxiety, the depression, the brain fog all start to linger. What I see is, oh, I'm getting a bit too many headaches, too many migraines. My period has become irregular in time and in flow as well. The loss of libido, a lot of IBS, so a lot more constipation, a lot more bloatiness, a lot more, and we know with irritable bowel syndrome is very much of a mind-body connection. So that is quite important to realize, okay, could it be my hormones? But then we cannot, again, the holistic approach, zoom in, zoom out. Could it be my hormones? It is a part of it. Could it be my lifestyle? It is another part of it. And I will talk about it in the future slide. When we the more, so near the later stage of perimenopause, which is, so remember, menopause is globally by definition at 51. Women of Asian, more like Southeast Asian descent, will have a menopause time of around 47 to 49 years of age. So they will go into the menopause a little bit earlier. Okay, so the symptoms are listed: hot flushes, night sweats, sleep disorder, joint pain, irritability, anxiety, depression, fatigue, brain fog, dryness. The postmenopause symptoms are everything with adding to the frequency of urination, the vaginal dryness, the bone density being lower, the muscle mass, the higher visceral fat, causing insulin resistance, the higher risk of heart disease. Very important slides again. I'm so sorry. I'm going to the scientific background here, but this is to understand that what you are feeling is literally in your head, and it's true in a scientific way. Okay, so we have estradiol and testosterone receptors all over our brain. And the frontal cortex is all about problem solving, organizing, the wisdom, your personality, being able to coordinate things in a smooth way. All that planning that you do so well, the intellectual side, is all in the frontal cortex. The middle part of the brain, which is thalamus, hypothalamus, hippocampus, amygdala, and all that, that's the limbic system. That's the emotion system. Okay, all of that, as you can see, have red and yellow dots, have receptors of estrogen and testosterone. So what happened during the perimenopause? The amygdala is the emotion. So suddenly that mood swing, just crying for no reason, the anxiety and everything like that. Hypothalamus, hypothalamus, which if I remember it well, control the appetite and the temperature system. So suddenly it's too hot, a little 1 degree up at home, so you're getting night sweat. So you forever fighting with your husband with the aircon remote control and the kicking of the linen and everything like that. Memory, thalamus, hippocampus, memory storing. So what happened? You become emotional and you're finding how to be rational. So there is a disconnection in that sense. And many women do not understand. They go through it. With their work. They don't consult a doctor, and they might see a psychiatrist or psychologist. They will get better. They might not get better. They get put on medication. It will work. It will not work. But if you don't think in the context of menopause, and you, for example, if the symptoms are quite severe, you don't go on HRT, you might go through an unnecessary, more difficult period of your life. Okay? Cerebellum is about balance. Okay, so...
Sorry, Dr. Valerie.
Yes.
On the call who may not have heard the term, but HRT stands for hormone replacement therapy.
Oh, I'm sorry, yes, hormone replacement therapy. Yes.
Some people now call it more menopause hormone.
That's true.
Replacement.
Yes, that's true. It's more, yes, the later term is menopause MHT, menopause hormonal therapy, yes. So women, so what do they say? I don't recognize myself. They are not a real patient, okay? I don't recognize myself. This is what we get. I'm losing my mind. What do you think it is, doctor? I've forgotten so much now. What they are afraid of. My mother has dementia. Does that mean I'm going to get it? Okay. Now, dementia is a whole different topic when it comes to lifestyle medicine. Very happy to talk about it. It will take me another hour. But there's a concept of epigenetic and genetic. And the good news is genetic is about your DNA that you had inherited from your parents and your ancestors are only between 5 to up to 25% of your health destiny. Epigenetic is very much on the environment, your lifestyle, the environment that you live in, that is a determining factor of your health destiny. So it tells you that you have at least 75-85% control of your health.
Amazing.
So, for example, you can live you are smoking, you're living in a smoking environment or in a very high polluted area, the risk of lung cancer will be high.
Mm-hmm.
That's what I meant. So back to this slide. I'm so sorry, I'm diverting. Yes, I feel so anxious. I'm so indecisive. I can't sleep at night. I get angry at the smallest things. Psychological symptoms, very prominent. I think it will affect about 40% of women on average. They get anxiety symptoms. They are scared. They are more tense, overwhelmed. They're losing their confidence. They're getting anxiety and panic attack, difficulty breathing. So they're getting the physiological effect. Palpitation. My chest is tight. I have a sick feeling. I'm ruminating, meaning I'm thinking about the same topic over and over again, and I can't let it go, and I cannot sleep. Or I'm waking up at night, and I cannot go back to sleep for 1 hour, for 2 hours, and so on. Depression, low mood. I'm losing pleasure in life. I'm irritable. I'm teary. I'm angry. Brain fog affects your memory, your concentration. I cannot make a decision. Avoidance, isolation, low motivation and drive, lots of self-doubt, low self-esteem, loss of pleasure or interest, low libido. It can also manifest as paranoia symptoms, lots of feeling of guilt, worry about being judged, distrust of all those people's intention, worried about losing our job, about being replaced, about losing our marriage, I'm not being loved anymore. By the way, the rate of divorce is quite high around the perimenopause. Yeah. Perception that something bad is going to happen. Okay. Not told, suicidal thoughts increase sevenfold in the perimenopause age group, 45 to 54 years old, compared to women of older age group and men of older age group. Men of the same age group and other age group. And this article on the left is in the Independent UK, written, published in October 2021, and fear of being labeled hysterical. So the stigma about it. 1 in 10 women experience suicidal thoughts due to perimenopause. Many women are suffering in silence, not even talking to their partners or spouse about. This is profound. This is really profound. And I'm so glad they have published this. Remember the looking at a patient in a holistic manner. So the risk factors for depression, for mental health issues. Okay, so very busy slide, very important slides. I will try to go through very, very quickly. So the pink, the light pink and the deeper pink are the negative risk factor, if you like, that could make mental health worse. And the blue part is the protective factors. Okay, so the higher risk factors are going into menopause early, having surgical menopause. So meaning that you had a total hysterectomy due to endometriosis or due to breast cancer, for example, breast cancer treatment, or you've gone through a very long menopause transition. Your symptoms, mainly the severity of your menopausal symptoms, really the lack of sleep accumulated over time, the severity of your vasomotor symptom, hot flush, night sweating, and so on. The hormonal factors, how much the estrogen is going up and down. So, for example, women, like I said earlier, you can have high estrogen in the morning and very low 2 hours later. That attitude towards menopause and aging. So if your perception of, that's when lifestyle medicine, psychology, cognitive behavioral therapy comes into place. If you think menopause, end of fertility, and this is what happened in the Middle Age, right? In the Roman time, menopause is end of fertility, so it's aging and loss of your youth and everything. This is when we can talk about it. Well, let's change that perception. Let's embrace what's happening to us. We need to embrace that what is happening is natural. We can make it work for us. We can embrace it through our lifestyle by living well and healthily and getting as much support, and also recognizing that when you go through a darker phase of your life, what you can do is learn about it, embrace it, and come out with solution. The established psychosocial risk factors on the right-hand side. For example, if you have a difficult childhood, a difficult teenage years, with going through seeing divorced parents, bully, abuse, suffering from depression, lack of support, perinatal depression, compounded with stressful life event, meaning that having conflicts with your loved ones within your family, but also your conflict at work, conflict in your environment, having financial difficulty. We know that around this time, career women, changing job or being made redundant or something of that sort, of a minority status, losing our work, not having the financial means to support our families, the lack of social support, talking to someone about this, the lack of being understood, And also lifestyle factors. The higher the BMI, not having the time or taking the time to exercise, not eating healthily, smoking, alcohol, that kind of thing. Personality traits is also a factor. So all that compounds and will tell us whether that would be a risk factor for more severe mental health issue during the perimenopause. Protective factors, getting the support. Yes?
Sorry, Dr. Valerie, we have quite a few questions in the chat. Would it be okay for me to ask them now?
Okay, please do. I know I do have a few more slides to go through. That's okay. Yes.
A little bit tongue-in-cheek, I guess.
Yes.
Mom is saying, is there anything to look forward to? You know, is there a silver lining in this perimenopause phase as well? Or is it all doom and gloom?
It's not all doom and gloom. Okay, so I will try to find more good slides. Okay, the good thing about it, when you go into the menopause, after the menopause, you don't have to go through the yo-yo of having your period. You don't have to go through the yo-yo of having painful period, about having heavy period, about having the mood swing once a month, about the irritability, the migraine, the headaches, all that depending on your hormones. Women, once they have gone through the transition of menopause, are actually wiser, and they remember the brain, the frontal cortex, which is all that planning, thinking clearly, concentration, memory, and all that is more enhanced, and you have less of the limbic system, which is the impulsive system. Yes. Okay. So you have less of the emotional trait. So you will embrace so you will embrace the menopause a lot more in a serene way. So in our ancestors, for example, we tend to go towards the older women for advice, for wisdom. We go to our grandparents for advice and wisdom. Yes. Okay. And I must say, the survey has said that postmenopausal women it's a new part of their life. They feel happier, that they have never been so happy in their life. They can do whatever they want. They can, and remember the brain neuroplastic, we call it. You can develop part of your brain. So go and pick up Latino dancing. I don't know, something that you would like to have done because you couldn't do because of your career and your children and everything like that. Just start exploring it. Start playing a new musical instrument or something like that.
Amazing.
So there's a lot of things to look forward.
Okay. Sorry.
Okay. So you want me to just answer the questions? I'm happy to just answer the questions. Yeah.
Just this before, so we make sure that we cover it. So one mom is asking, she has had a child at 43. Would that mean that her menopause might be delayed, or might she even go into menopause earlier, or does it not affect it at all?
Okay. So again, I need to zoom out and look in the broader context.
Okay.
Okay. So I need to look at was it easy for her to fall pregnant?
Mm-hmm.
Was she on IVF, that kind of thing? Are her period regular? Mm-hmm. How old was she when she just had her period? Yeah. So the longer your, so we are born with about 2 million eggs. By the time of puberty, we have about 400,000 eggs. Around the menopause, 50, we have about less than 1,000 eggs. So all that needs to be taken into context. So if my advice, sleep well. You need your 7-9 hours sleep. Okay. It's not negotiable. There's no such thing as I don't sleep enough during the week. I will catch up on the weekend. There's no storage in your brain somewhere like a bank where you can accumulate sleep and it will work. Sleep well, eat well, fruit, vegetable, plant-based protein, that kind of thing. Don't drink, don't smoke, exercise, work on your stress. All that will help you for your fertility. And when sometimes we do a blood test about, especially for men, low testosterone level, that kind of thing. Well, look into factor. You can increase your testosterone level, and you can increase the quality of your sperm and your eggs with healthy living. And I have seen over and over again, 2 weeks later, 1 month later, my goodness, your cholesterol is so much better. Also, sperm quality is so much better. Testosterone has gone up. Everything of that sort. Healthy living.
Amazing.
Yes.
One more.
Yes.
Yeah, more about how conditions such as endometriosis, PCOS, and so on may be influenced by or may influence perimenopause symptoms.
Okay. Very, very good question. Big topic again. Very big topic. Oh God, where do I start? Okay, it can. Endometriosis and PCOS there's an element of a genetic factor, okay? But there's a big element of an epigenetic factor, which is lifestyle related. So you can live through your endometriosis and your PCOS by reducing the symptom and increasing your chance of fertility with the lifestyle medicine. So here we go. I was looking for this slide. So if you are engaging on healthy, clean living, you can improve your fertility level. Yes. But you're asking me about the perimenopause. Yes. So all that again, those 6 pillars of lifestyle medicine are extremely powerful. Okay, so lifestyle medicine is basically looking at how well you eat, for example, fruit, vegetable, and all that, and using that to treat and reverse your symptoms. This is how powerful it is. So in terms of the perimenopause, we use that a lot, and it has shown, for example, hot flushes, night sweat, hot flushes during a meeting linked to, you're having a meeting with a lot of men out there. No disrespect, okay? But you do feel a bit more stressed. So you're getting a lot of hot flushes, and it affects your concentration. Suddenly, if you work on your breathing, your deep breathing exercise, your mindfulness, visualizing that everything's going to be okay, reduce your anxiety level, you're reducing your hot flushes. So talking about PCOS and endometriosis, exactly the same complex. It depends again the severity of your PCOS or the endometriosis and all that as well.
Great. Okay, I think we only have 7 minutes left. So Dr. Valerie, I'll let you choose whichever you think are the most important slides to take away.
Okay, I could talk about. Okay, so do you want to know about MHT?
Yes.
Okay, MHT. Okay, I think this is an important slide. There's a lot of stigma about MHT saying that, oh, well, mom and dad, my GP, my mother's GP, that have said that please don't stay away from MHT because you're going to get breast cancer. You're going to get heart attack. Now, that study, it came from the WHI study that was published in 2002, and it says that it was causing breast cancer and heart attacks. So all the women, including the doctors, told them to throw away the HRT, the medication. So they had to put up for 20 years. With hot flushes, all in silence, because thinking there's nothing we can do about it. Now, around 2022, they look back at that study and they said, oh, hang on, they used the wrong molecule of HRT, the wrong, a synthetic HRT, progesterone estrogen, it was synthetic, and it was a higher dose in the wrong group of women, meaning that the average women who were on it were in the late 60s, early 70s. Now, when you think about menopause, starting at 51, if you start 20 years after, yes, everything has changed. Your arteries are hardened, the heart, there's blockage in the heart and all that stuff, okay? So, of course, and there's more visceral fat, more adipose, more fat mass. So your risk of breast cancer and all that will increase. So now we are saying, let's start in the perimenopause time, before even you reach menopause, and then you continue for 10 years. So looking at HRT, this is quite an important slide. I'm really sorry about this blue scribble. So they look at the study of 1,000 women in the age of 50 to 59. The baseline, this is a UK study, 23 cases of breast cancer diagnosed per 1,000 people in the UK population over the next 5 years. Now, add 24 cases if your BMI is over 30. Add 5 cases if you drink more than 2 units of alcohol per day. Okay, alcohol is linked with breast cancer. 4 cases in women on combined HRT. Now, this is more the combined HRT, meaning that the normal sympathetic HRT that you take by mouth.
Mm-hmm.
Okay. It's still less than breast cancer and BMI. And 3 cases more of breast cancer if you are smoking. Now, reduction, if you are exercising 2.5 hours per week, you are reducing your risk of breast cancer by 7. And if you are on estrogen only part of the HRT, you are reducing your breast cancer by 4 cases. But that's for women who have had a hysterectomy, for example, and do not have endometriosis. Okay, so this is to say that HRT will help you, will not cause an additional, is not associated to higher risk of breast cancer, and the benefit of HRT outweigh, because if you are not sleeping at night, it will affect your mood. It will affect your productivity. It will affect your marriage, I'm sorry to say. It will affect, one of the slides, quickly. Here, it will, your relationship, it will work. 45% say they struggle because of menopause symptoms in the workplace. And they cannot tell the boss why they are taking time off. It will take a backseat on the social life. Now, the gray slide at the bottom right, 28% of partners say they often end up having arguments because they don't understand what the wives or the girlfriends are going through. So this is when HRT comes into place. And looking at my patient, there is a massive transformation. I see them a few weeks later, a few months later, they tell me, my goodness, I am back to myself. I wish I started early. I wish someone told me. I wish my parents told me. I wish I wish this is informed and I can do something about it. I feel back to myself.
Yeah, that is really important. And especially, I think, in the workplace, it is not recognized. There's not enough importance given to moms going through this phase of their life. Yes. And so I think there's a lot of education that needs to happen in HR departments as well, companies, the C-suites, and so on. So really important topic to raise.
That's right. Yes, sir.
Amazing. Dr. Valerie?
Yes. I'm sorry I skipped through. There was so many information, but this is to say that there's so much to talk about. Yes.
Amazing. What I want you to do is to just say where people can find you and how to get in touch. You are practicing at Osler Health. We mentioned that at the beginning. Which of the practices, which of the clinics are you?
So Osler Health International. I'm based at Star Vista.
Okay.
At the Star Vista. So we do have 2 clinics. One is at the Raffles Hotel, and the second one is at the Star Vista, Druon of Osler. So it's about one stop off Holland Village.
Yeah. You obviously have a huge variety of different doctors with different specialities, which is why we like to refer to your clinic, because you basically treat people from the very start of their lives to the end of their life as well. So family practice as well. So that is really good for people to know that there are multiple doctors who specialize in this area and can help you, and they do all the testing, of course, and so on. So we encourage you to reach out and get some support in this important phase of your life. The sooner you see someone, I think, the better. Tackle it early, get everything, get your ducks in a row in terms of changing your diet, in terms of taking exercise seriously, prioritize your mental health. I think that is another thing that I took away from this too, is that I had no idea how much of an impact perimenopause has on mental health.
That's right. That's right. Yes, yes. It is so important. Don't go through it yourself alone. So important.
Yeah.
Remember, it is a natural transition. It's not, you are not going crazy. It is a natural process. So there's a hormonal imbalance, scientifically proven that is happening, and you do not have to go through it alone.
Yeah. And I like your approach as well. I think this holistic approach is so, so important because it's not just about replacing hormones, but it's about making lasting changes in your life and understanding what happens and what is affected and giving you the power as as your own person to actually take charge of your health and take charge of your perimenopause. And I think you need a partner for that as well. So thank you so much, Dr. Valerie, for spending the morning with us. I'm super happy to have had you. It was very informative. Lots of moms said in the chat it was so important to attend this talk and they learned a lot. So thank you very much for this wonderful morning.
You are so welcome. I'm not very tech savvy, so I will show my face again, but I don't know how to do it. So I'm so sorry. Yes, I will meet you in person. But I'm so glad that you are, and please make your husband listen to it. My husband know all about it.
Amazing. We'll share the recording and you can definitely show your partners at home.
Right, that's right.
Okay.
So you please take care and understand your teenagers. They're going through it in a different way. Yes.
Learn to understand you as well.
Yes, exactly. That's right. Okay. Thank you so much, Joanna, for the opportunity.
Bye.